Hey everyone, so as promised, here's a video on the COVID antibody testing that we have here in pharmacy now. So first and foremost, I want to stress that this does not test for an actual infection that is happening now for COVID. So if you think you have been exposed or you think that you have symptoms indicative of COVID, you need to speak to your healthcare provider and go and be tested at your local testing site. When you're doing that, we are checking, usually we're checking for the viral genetic material or RNA. Okay, so that's checking to see if the virus is replicating in your body. That is not here. Again, that's at a local testing site. So Essentia, Virginia, the site between Essentia and Fairview in Hibbing. What we have is an antibody test. So your body is making antibodies if your immune system has seen or fought off COVID-19. So the test that we have is approved for use. It's CLIA waived, which means places like pharmacies that don't have a full lab can use it because it is just a simple finger prick. So when we do it, it's just finger prick, a couple drops of blood. It's just a testing stick that we put it on and it reads within 15 minutes. So right now, because COVID cases are rising very rapidly, which I do want to stress, COVID cases are rising very rapidly in our area. Just anecdotally from the patients I have heard in the past 5 or 6 days who have told me they have tested positive or have asked for contactless delivery, I would expect to see a pretty stark increase in numbers on Thursday. So because of that, we are trying to do all of our kind of close contact things curbside. So immunizations, flu shots, shingle shots, we are still doing. I'm trying to do most of those curbside because it cuts down on really close contact. This test would also be pretty easy curbside. If you've ever had to prick your finger for like home glucose testing, if you're diabetic or have had to test your blood sugar, it's pretty similar. It's exactly the same thing. Prick your finger, get a little blood. For the more nitty-gritty of the test, so we're testing for 2 sorts of antibodies that your immune system would make. There's IgM and IgG. So IgM, your body makes, 7, 8 or so days after infection, or can start making that soon. It might take a little bit longer. IgG lasts a bit longer and it comes into play or shows up more, it can be several weeks after infection. So we really want to stress that you should, if you think you have had COVID, especially people maybe were sick in the spring and unable to get tested when testing regulations were a lot stricter, definitely wait at least a month from when you think your symptoms had onset, because that gives us plenty of time to get an accurate result. Insurance doesn't cover this. Our cost is $45. We do have a form that you can send to insurance, but as of now, I would not anticipate insurance covering that for you or reimbursing you. So for that reason, I really stress wait at least a month. Definitely don't come within 2 weeks of onset of symptoms, because you could, that's the time that you're supposed to be quarantining. A lot of the question surrounding antibodies is, are they protective and how long would they protect us? And that's kind of the big question right now. Most of the information we have is just looking at case reports and looking, we're far enough out to see some reinfection. So the CDC has said, hey, we have case reports of reinfections within 90 days. Maybe not a lot, and that still needs to be kind of parsed out and really verified. But that's a pretty recent thing that the CDC has come out with. Previously, they were thinking, at least 3 months if you have antibodies, you're going to be protected, probably longer for most people. But we don't know yet. That's something that just takes time and experience, and it takes people getting infected and getting reinfected to see, what's common and what's happening. The good news with this test is that it works a lot better. It's a lot more accurate than some of the antibody tests that we had earlier on in late spring, early summer. Those gave a lot of false positives. So for this test, the specificity is pretty high, so about 98%. So it's specific. That means specific for COVID-19. Not going to see, you know, a different sort of antibody that looks pretty similar and pick that up and say, oh, hey, we have antibodies. That's good, because there are just common colds that are coronaviruses. And so, you know, it'd be easy for an antibody test to pick up on those antibodies, and probably a pretty sizable chunk of the population would have those antibodies. We know from the common cold coronaviruses that those antibodies do wane over 1 to 2 years for sure. We don't know right now for sure how long IgG is going to last, or antibodies for COVID-19 will last. It's likely dependent on your level of infection and just the immune response that you had. So it's probably different for different people. Right now, I mean, it's obviously a big issue to figure this out, but you know, we're just dealing with getting testing and contact tracing right now. So it's on the burner, but it's maybe not right at the forefront. In terms of sensitivity of the test, so sensitivity says, if you have COVID-19 antibodies, will this test actually see it? How likely is this test to miss it? I'm very sensitive, again, like 98+%. So these tests are a really big step up from the spring and the summer. That means that you can get a pretty accurate result. In terms of what that result means, I really want to stress that that does not mean that now you are home free. You don't have to wear a mask. You get to say, I had this test and now I'll do whatever I want. We don't know exactly how much protection it is for everybody. So we are still going to practice social distancing. We are still going to wear masks, still do all the same things. But for people who think they've had an infection, it is a little bit of peace of mind to know that that's what it was, or that's likely what it was, and to know that you have some antibodies, you have some level of protection. We really encourage you to call and speak to our pharmacist before you get this test. So you've got to talk to us. You know, we want to make sure that that you really understand what this test is and what it is not. And when you get the test, again, just some drops of blood, 15 minutes, but our pharmacist will call you and discuss the result with you and what it means for you. So again, big stressor is this test does not mean that suddenly life just goes back to normal for you, unfortunately. And COVID cases, once again, as we all know, they are rising rapidly. So we are a very, very, very hot spot right now. We're rising very rapidly. So, you know, it's hard because we all put in a lot of hard work in the spring. And I know that people are getting a little worn out and they feel that I did this in March, I did this in April, I did this in May, and we did do it. One of the best things I read is that some of the communication problems with COVID-19 occurred early on when it wasn't well communicated to the public that success is going to look like an overreaction. So if we succeed with what we have done, it's going to look like we overreacted. That's a good thing. So a little bit, if you do well, you're a bit a victim of your own success. So right now, whatever we did in the spring, whatever we didn't do in the spring, whatever we didn't do or did do in the summer, we can say that right now, we have a lot of cases on the iron range. They're rapidly rising. So this is the time to really think about, if you tested positive today and you have to contact trace for 2 weeks, would you even be able to do that? Have you been few enough places and kept a small enough circle that you would be able to say, here are the people I was in close contact with? So again, that is within 6 feet for 15 minutes, inside, outside, with a mask, without a mask, within 6 feet for 15 minutes. The CDC now says that 15 minutes can be spread over a 24-hour period, which is, you know, that's a new recommendation from the CDC, but that's what a close contact is. So even if you're outside, still applies, right?